Right, let's make a start. Thank you so much, Jessica, for joining. We're expecting a few more people to join, but we need to make a start so that we could finish in time. So over to you, Asma, for a brief intro, and then Dr. Umar will take over from you.
Hello, thank you, sir. Good morning, good afternoon, everyone, and a very warm welcome to all for you joining us today from different parts of the world. My name is Asma, and I am delighted to host this free webinar organized by our team. Today's session is dedicated to an important and exciting topic: medical training in the UK, foundation year, specialty, and beyond. For aspiring doctors and healthcare professionals, the UK remains one of the most attractive destinations to pursue medical education, training, and career opportunities. Our learning objectives today are clear and practical. We will begin by understanding the UK Foundation Program, which is a very first step for medical graduates to begin their clinical practice journey. Next, we will explore the career pathways to becoming a consultant or GP, both highly respected and rewarding roles. Then we will look into application and portfolio strategies to help you stand out and secure the right opportunities. Finally, we will discuss exams, mentorships, and CPD support. So we have a complete roadmap for your medical career in the UK. This webinar will not only give you insight in the structure of medical training, but also share real experiences, practical advices, and guidance to help you prepare effectively. We are truly honored to have with such two amazing speakers who brings a wealth of knowledge and experience. Excuse me, sir. Excuse me.
It's okay, Asma, don't worry. It's happened to famous celebrities as well. Just carry on. This is what happens on online calls. Don't worry.
I'm sorry. I'm so
Continue.
sorry, sir. Sorry. We are truly honored to have with such two amazing speakers who bring a wealth of knowledge and experience. They will guide you, support step by step, as also take your questions at the end of this session. Please make sure you stay with us throughout the session and don't hesitate to write your questions in the chat box. We will try to answer as many as possible. Once again, thank you for taking the time to join us. By the end of today's webinar, you will leave with a much clearer understanding to how to navigate a journey towards a medical career in the UK. Let's get started. Over to our academic lead, Dr. Umar.
Thank you, Asma. Thank you for the introduction. Thank you, everyone, for joining. And thank you for that little comedy moment, which let's hope is not the most exciting thing that happens on the webinar. Hopefully, there'll be some interesting things in the presentation as well. It's a pleasure to be here and to speak to you guys both on the webinar and through our live stream to give you some advice and guidance about the PLAB pathway and careers in the UK. And today we're going to focus on medical career pathways in the UK, particularly the foundation program, as well as others as well. So I'm just going to get my presentation and then share my screen in a second. Okay, please, Asma or Dr. Skill, please confirm that
we could
it's
see.
visible.
Yeah.
Okay,
Yes,
and
it is.
yeah, great. All right, thank you. So not going to spend too long on here, but Hive, we essentially we help people in their medical and affiliated health professional programs. Do explore our website for more information on what kind of things we do. The learning objectives for today, we are going to discuss the UK Foundation Programme, what its purpose is, what's the structure, and how can you be eligible and apply for it. We're going to discuss career progression, various options. We will also touch on alternative options to specialty training and GP training for IMGs, for international medical graduates who want to work in the UK. There are other options available as well. And we will discuss what are the practical steps that you can take to ensure that your applications are competitive and that you are actually, giving yourself a good chance of being shortlisted and actually taking up a post. And we will briefly discuss what kind of support structures are available, how Hive can help, as well as the other resources that are available out there. So medical training in the UK is highly specialized. It's very structured, and it takes you through no matter what your intended career pathway is, whether it's a conventional one, or even if, like myself, you took a little bit of an unconventional route in the sense of opening up new opportunities in your career path. There's lots of opportunities available. It is up there as one of the best places to work and train in the world, and that's why lots of people are obviously interested in coming to the UK. So I myself, went through medical school in the UK, and I also went through foundation year training and then GP training, and I was a practicing GP for 10 years. I had a portfolio career as well, so I also went into teaching, lecturing, into medical political work, as well as also clinical leadership work. So, varied a kind of clinical career before coming fully onto the medical education side of things. So it starts with foundation year program, a foundation program, which is 2 years, and then it proceeds on to specialty training and GP training. As I did mention earlier, there are a couple of other options available as well, which I will leave for a bit later on. Maybe Dr. Shakil can help us with that. So what is the foundation program? The foundation program is something that came in quite a long time ago. Previously, we used to have the compulsory 1 year house officer or pre-registration house officer program. And then this was replaced with a 2-year program for all doctors, and it is compulsory for all doctors who want to work in the UK to go through the foundation year program, especially if they are graduating in the UK. It's not necessarily the case for IMGs. There are other options available for IMGs as well, but in terms of the foundation program, it's highly structured, very well supervised. There's lots of opportunities for learning, supervision, progression. You get fantastic opportunities to try different specialties. You can rotate around medical and surgical specialties, as well as the other specialties as well, such as pediatrics, obs and gynae, general practice, etc. The first year is foundation year 1, where you are working. You do work independently as well, but you are supervised and you are provisionally registered with the GMC. Once you complete foundation year 1 program, you move into foundation year 2, which gives you more freedom. You have more responsibility. You still continue to get exposed to different rotations and specialties, and you are fully registered with the GMC. And as I mentioned, it's a key requirement for progression into training for any specialty, whether that's general practice, medicine, surgery, peds, obs and gynae, psychiatry, whatever, ENT, etc., etc. Just briefly, a little bit more on the foundation year program. So it is, as I said, it's highly structured. You have a portfolio, you have a clinical supervisor who is your consultant on the particular rotation. You also have an educational supervisor as well, who looks after your kind of educational and training side of things. You have to maintain your portfolio, you have to engage in audit, you have to do case-based discussions, you have to do clinical examination and evaluation exercises. You have to perform certain DOPS, which are direct observation of procedures. So it's very, very focused on training and development. It's a very exciting part of your career. Remember F1 and F2 being really, really exciting. You know, you're freshly out of medical school. Working for the first time, putting all that theory into practice, seeing your acutely unwell patient for the first time, attending a crash as a doctor for the first time, lots of potential to be involved in stuff that you've been working towards for many, many years. Now, in terms of IMGs, you can apply for the foundation program directly. You can apply for foundation year 1 as well as foundation year 2, depending on the level of your experience in your own country. But you can also apply for some other types of roles as well, which I said we will leave for Dr. Skeel to discuss a little bit later on. So in terms of after completing the foundation year program, there are training pathways which are of various different types depending on which specialty you want to go into. There are, for example, core training pathways which give you entry to specialties like medicine, surgery, anesthetics, etc. And some of these you will have to apply for entry to the initial part, which might be the first 2 years or 3 years, and then reapply for entry into the second part, which is for the remainder of your specialty training. There are also run-through training programs which result in you being given given a number on a program where you are going to be involved. You are going to have your career path set out all the way from your first year of specialty training, which is after FY2, of course, all the way through to year 6, 7, etc., depending on the specialty. These ones are around for things like pediatrics, obs and gynae, psychiatry, and some others as well. As I said, there's the core training part, which will be the same for certain specialties. So, for example, acute medicine, anesthetics, you might do the first couple of years the same before branching off, or you can go into run-through training where you go directly to particular specialty and you have that 6, 7 years of training all laid out for you ahead. There are also options for dual training as well in certain fields. So whether you want to be a senior doctor, a consultant in hospital medicine, or you want to be a senior doctor in community or family medicine, the pathways are different. In order to become a consultant in medical or surgical or the specialty field, you need to complete your years of specialty training and get your CCT, which is your Certificate of Completion of Training. For becoming a consultant in general practice, or which is known as family medicine in other countries, There is a 3-year program after your FY1, FY2. So it's shorter. 18 months of it is in hospital, and then 18 months of it is in the community. Now there were intentions to extend that to 5 years, but that hasn't happened yet. That's been a discussion that's been going on for a long time, even since I was doing my training as well. So currently it's 3 years. So you could be a senior, consultant, senior doctor in community medicine, family medicine, general practice within 5 years of graduating from medical school. Now that is the shortest route to the highest kind of level of a doctor in any particular specialty. Obviously, I had a fantastic career in general practice. The opportunities are really very different from hospital and secondary care based medicine, where there's lots more opportunity to be involved in other things, both associated with your medical career or totally different. Leadership, teaching, research, clinical leadership work, medical political work, lots and lots of things are available. And some of these are available as well in secondary care. Now, all of these specialty training programs are competitive applications, and you will be doing specialty exams at various points of your training. So whether that's membership of the Royal College of Physicians, surgeons, general practitioners, psychiatrists, or whatever. Just before going on to what are some of the challenges for IMGs, as I mentioned just on the one of the previous slides, that you can apply directly for foundation year program. The dates are quite specific. Obviously, if that's something that you are interested in, the specific details and requirements of that, you can approach us to ask questions about, or you can go and have a look on the foundation program website. The dates of applications, eligibility, and these kind of things are quite important. Foundation year program is also applied to by all of the local graduates as well. So that is also a competitive application process. But you are, at the end of the day, you are trying to work and train in one of the most highly respected training and healthcare systems in the world. So of course it's going to be competitive. So that's something you should expect. So what are the challenges and the opportunities for IMGs who are wanting to come and work and train in the UK? We speak about these a lot because obviously we help doctors, we help medics transition through this process. Some of it is obviously to do with a change in system, a change in the way of practicing medicine, a change in guidelines, and a change in culture in terms of medical practice, as well as NHS culture as well. There are other logistical things such as visa applications, sponsorship when it comes to work. So there are lots of challenges, but as you may know, tens of thousands of doctors apply every year, sit the PLAB exams, and do attempt to start a career in the NHS. And that is because the career progression, as we've already discussed, is the opportunities are fantastic. It's highly prestigious to train and work in the UK. There are strong, the training programs are fantastic. There are strong support networks. There's IMGs who have been working in the UK for decades. They do really good work in supporting IMGs. There's lots of mentorship available, and there's lots of opportunity to improve your career and either start a long career in the UK or come and spend some time in the UK, and then if you wish, you can return to your home country, or you can even go onwards to other places as well. So there are lots and lots of opportunities, as well as some of the challenges. Excuse me. So when it comes to somebody who's interested in working in the UK, we always speak about the quickest, the easiest, and the fastest, as well as the cheapest route for trying to start a medical career in the UK, and that is by, without a doubt, the PLAB pathway. It's as we said, it's it's the quickest and it's the easiest route in terms of the level of examination. It's just just a year above what is expected of a medical graduate. So it's the level of an FY2 doctor. And so it's not, although it's different, it's not that far above what a medical graduate is expected. And with the expected to know and be able to apply, and with the aligning of the PLAB curriculum with the UK medical licensing assessments, that is, it's even closer to that now. So what kind of things can you do in terms of improving your chances of being successful in a UK medical career? You need to try and build a strong portfolio and a strong CV early. Do get involved with audits, do get involved with teaching, with research wherever there are opportunities available. Do prepare for competitive applications. It will be competitive. You will be up against many people who are who are highly capable and qualified, and so you have to set yourself apart. It is also extremely useful to stay up to date with things like the GMC guidance, NICE guidance, NHS values, but perhaps more importantly, which is what we highlight and what we focus on a lot at Hive, is the seeking of mentorship. Because if you are guided by people who have actually worked in the NHS for decades, they've been through the training system, they know how things work, they know how the examinations work, they know what the examiners look for, they know what interviewers look for, they know what CVs should look like, you have a much better chance of being successful than if you were either trying to do everything on your own or trying to get advice and guidance from people who've actually never worked or trained in the UK. So how can Hive help? Well, we can help basically from the very first time you actually think of a UK-based medical career. So we deal with the whole PLAB journey, even helping with IELTS and OET preparation, which comes before PLAB1. So that's the examination side of things. But in addition to that, which is what sets us apart at Hive, is we actually help people with clinical attachments. We help them with their CVs. We help them with any advice and support they might need around visas, GMC registration, and then afterwards trying to give them a good chance of being successful in job applications. So setting up a job profile, knowing which jobs they should apply for, training, preparing with mock interviews, and actually providing you that support until you secure your NHS role. So, just to very quickly summarize, the UK is a brilliant place to work. Both myself, Dr. Shakil, we had fantastic clinical careers in the UK, and we would always encourage people from other countries who are interested in an exciting rewarding, both emotionally as well as financially. A career, a rewarding career in the UK would be something that we would highly encourage. There are, as we've only very briefly spoken about the foundation program, specialty training, but as I'll hand over to Dr. Shakil in a minute, there are other options available as well, because you might not fancy the idea of a 3, 6, 7 year training program. You might feel that you've done enough training, you've worked hard, you want to maybe just focus on working and providing for your family, so you don't have to go down the training route. There are other options available as well. Do ask us any questions that you might have, but I'll just briefly I'll hand over to Dr. Shakil so he can tell us about other opportunities and other pathways that are available for IMGs.
Thank you so much, Dr. Omar. That was very good summary of the training, medical training in the UK. There is the foundation program or the training to become a consultant, a community consultant, general practitioner. But this is not it. There are lots of opportunities as NHS is world's largest employer and the healthcare system. So if somebody doesn't want to go into training, either for general practice training or specialist, they have other opportunities, like they could apply for non-training post. The non-training post are junior clinical fellow, senior clinical fellow, then they have got the trust grade post. On top of it, if you don't want to do permanent job, like junior clinical fellow, senior clinical fellow, they have the option of locuming. Either you could do locum through a locum agency, or you could join the NHS professional through hospital. The hospital, all the NHS hospital trusts, they have the NHS professional body. They provide you the locum contract. Locum contract means, like, either you get the 1 day job, 1 week, or 1 year. That will be, you will be paid per hour. So in slightly, you will be getting much more money as compared to your regular permanent job. But NHS is full of opportunities for doctors from all over the world, either it's the training or the non-training. And it also brings lots of other benefits, like you get the pension benefits, you get the discounts, you get the support for the mortgage, for the loan, or getting the new car, new house. So loads of benefits. You have got paid study leave, you have got annual leave, you have the courses, your study courses are fully paid, and you have got 32 days of annual leave as well. So yeah, and it's just a wonderful place. It's wonderful healthcare system and providing excellent services. So it's one of the best training system in the UK. The NHS training, like either it's a foundation program to the consultant or the non-training post. So if anybody wants to ask any question, Jessica, do you have any question you want to ask? Please feel free to unmute yourself and ask the question. Otherwise, feel free to visit our website, hivemedicalacademy.com. Everything is there, especially the Global Medics NHS program. If you're thinking of PLAB journey, are thinking of the career in the UK, NHS program is one of the best program for you, which will look after you from day one till you get the job, unlimited access and unlimited guidance support for you. So feel free to visit our website and contact us for any queries, any questions. If we have no questions, I think we will just close today's webinar. We'll be doing another webinar next month. We'll choose the topic. If you are interested for any sort of the topics, please let us know. Just drop us email that these are the things, these are difficult topics, or you want to know more about the career in the UK. I will be more than happy to help and support. So thank you so much, everyone. Thank you so much, Asma. Thank you, Dr. Umar. Thank you, Jessica, and other participants who attended the course, this webinar, and we'll see you soon. We're going to say goodbye to everyone. Thank you so much. Thank you.
Thank
Bye-bye.
you.
Bye.
Bye.